Okay, looks like we are live.
Please bear with us.
Yes, this is our first double Facebook Live, so we are kind of figuring it out.
There we go.
But yeah, it looks like we are good to go.
Mm-hmm.
Okay, great. So my name is Zazu Cioce. I am a pelvic health physical therapist here with Geri White, the owner and founder of Hudson Valley Physical Therapy. And we are here to do just a short segment, Myth Busting Mondays on Kegels. Okay, great. So my name is Zazu Cioce. I am a pelvic health therapist. One second, because I am hearing myself echo and I don't know where it's coming from. So let me just make sure. I don't know if it's coming from me or from you, Geri. I'm muted. Okay. All right. So I think we figured it out. Sounds good. Okay, cool. So we're gonna basically here to talk a little bit about just some of the common myths that we hear about Kegels and dispel them and basically teach you guys, the most important things to really know the truth about Kegels. All right. So Kegels are only for females. So males actually have a pelvic floor too. I have included some pictures here. On the left side of the screen, you've got 2 of the 3 layers of the pelvic floor in a female. So you've got the superficial layer and then the deeper layer. And then on the right side of the screen, you've got the superficial layer for male pelvic floor, and then the internal or deepest layer for the male pelvic floor. So Kegels are not just for females. Males have pelvic floors too, and they also have issues down there. And I find a lot of times actually men have more trouble talking about what's going on with them just because types. It's very embarrassing for both sexes, but definitely for males, it's harder for them to have somebody to even talk to about it or even know where to go. So Kegels are for females and for males. All right, so Kegels are only for young people. So this is another one that I hear from our clients that are in menopause or past menopause, or are male and in their 60s, 70s plus. But actually, Kegels are pelvic floor strengthening, and pelvic floor strengthening is good for anybody and everybody, and that includes all ages across the lifespan. And certainly as we get older, our body starts to change. We start to lose, muscle mass, and that also includes the pelvic floor. So being able to strengthen your whole body, but also your pelvic floor, basically helps decrease your risk for getting some issues down the line, like, leaking urine or leaking feces or leaking gas, pain in that area, all that stuff. All right, so Kegels are only for pregnancy or people who delivered vaginally. So while Kegels, which are pelvic floor strengthening, is good for, during pregnancy, it is also good for people who have already delivered or people in postpartum. And it's also good for, like we said, people who are not pregnant, so including males, including females who've never had babies, and including females of any age and range. So also another one that I hear is, well, I delivered via cesarean, so I don't need to do Kegels, or I don't need pelvic floor strengthening. And actually, even though there's lower incidence of, leaking urine if you deliver cesarean, a lot of times, and most of the times, that is not the only factor to determine whether you are going to have an issue with leaking urine. We have to think about that we carried a baby for 9+ months, hopefully. And that baby, you can see in this middle picture here, that baby and the extra weight of the fluid in the baby are all on the pelvic floor. And so it would be like you would be carrying, a 2-pound weight, then a 3-pound weight, then a 4-pound weight, and then, up to however 7 pounds, 8 pounds, 9 pounds, depending on how big your baby is, but carrying that around in your hand and never letting go. That is a serious workout for your muscles, and it's the same thing for your pelvic floor. So it's not only mode of delivery that, increases your risk for things like, leaking urine or feces or gas or having pain with sex. It's also just the physical strain that your pelvic floor undergoes during a pregnancy, and also what you did during that pregnancy to help yourself or not. All right, so Kegels are only for postpartum. So I hear this a lot of my moms who've already had their babies I was told that, don't do it during pregnancy, especially because I don't want things to be tight down there. So there is actually no evidence for that claim. And in fact, a strong pelvic floor and a fully functioning pelvic floor is actually very helpful for vaginal deliveries. So Kegels, pelvic floor strengthening is very important, should be a part of kind of your pregnancy preparation and your postpartum preparation and even your birth preparation, because they control those functions, which a lot of times, like, leaking urine, feces, gas, they control those functions. So to help minimize issues in that area during pregnancy, but also help recovery during postpartum, but also help prepare you for a vaginal delivery if that is, what is going to happen for you. All right, so then someone told me how to do Kegels, but they didn't work. So I hear this a lot as well. And actually, there is research to show out there that, a large percentage of people, 40, 50, 60% of people who are just verbally told how to do a Kegel do it incorrectly. So my, question would be, how do you know you're doing them right? And secondly, so maybe you are doing them right, but if Kegels didn't work for you, then you have to remember that Kegels are only strengthening of the pelvic floor muscles. You may be having issues because you have a coordination problem of the pelvic floor. You may be having issues because there's too much tension in the pelvic floor. And so by doing Kegels, you're not necessarily addressing the true root cause of why you're having issues. And so those are the two main things that I will tell my clients when, they tell me this, or when I hear this on the street. And it's one, how do you know you're doing them right? And two, if you're doing them right and they still don't work, well, then strengthening is probably not your problem. And it's best for you to have an assessment and figure out, like, what is your problem. And so, pelvic floor physical therapists are the evaluators of the pelvic floor muscles, and that's what we do. And so we can better give you exercises or tips or tricks to do to help yourself. Same thing with, how to do a Kegel. How do you know if you're doing them right? That was actually what our last class, the ultimate Kegel exercise class, was to really make sure that you knew how to do them right, and that you knew all the several different types of Kegels. So yeah. All right, Geri, anything to add? And if not, go right ahead. How do you know if you're doing it right? That was actually what our last class,
Okay.
the ultimate Kegel exercise class was to really make sure that you knew how to do them right, and that you knew all the several different types of Kegels. So yeah. I am hearing myself, and I think it is
Yeah.
coming from you if you have it up on your phone.
Yep.
So
Okay.
I just exited out of mine, and it.
Okay. All right. So I'm up. Sorry, guys. This is going to be a little bit. You might hear a little bit of feedback. So okay. So here is.
I am hearing myself, and I think it is coming from you if you have it up on your phone. So I just exited out of mine, and it.
Okay. Okay. All right. So I'm up. Sorry, guys. This is going to be a little bit. You might hear a little bit of feedback. So okay. So Zazu, can you just advance the slide? Thank you. Can you hear me as a echo? You okay?
It's delayed.
Yeah.
It'll come on. So if
Okay.
anything, just turn it all the way down, like to no voice.
To like that?
But it's working.
Can you hear me now?
Yeah, I can hear you. It's just the echo of whatever other page.
Okay.
Yeah.
All right. So this is going to be a little bit delayed. So in terms of my section, we're going to go through 5 of these myths. So Kegels are the only thing that matters for down there. Kind of, because Kegels are actually, we're gonna talk about them regarding pelvic floor muscle contraction. So there's a couple different ways to actually Kegel. One is what we all normally know, which is the activation, the shortening. So if you're doing a bicep curl, that's kind of like what's happening when you're actually doing a Kegel. So it's a shortening, it's an activation of contraction. The other component of a muscle strengthening is the eccentric contraction, which is what we know as a controlled lengthening of the muscle. So you need both concentric, which is a contraction like a bicep curl, so Kegeling, and then eccentric contraction, which is a lengthening, a slow lengthening of the muscle. That's 2 ways to strengthen your pelvic floor. And there's also a co-contraction, meaning the pelvic floor works with other muscle groups in the area to help with strength and stability, which we'll talk about in number 2. The other thing is not only do you need a good Kegel, but you also need the ability to relax a Kegel. So a good strong contraction, either concentric, co-contraction, but you also need to be able to release and relax the muscle to its stabilizing or actually normal resting length in order for you to get a better contraction next time around. Number 2 is Kegels don't work my core. They actually do. They are a very important component of your core. And if you look at the slide here, you will see there are 4 systems involved with your core. This is the front of your body. So your abdominal walls is one part of the system. The lower part of the system is your pelvic floor, which is here. The back part of your system, thanks Zazu, is your spine, and then your deep lumbar and trunk musculature. And then the top part of your core is your diaphragm, which is the muscle of respiration. So the Kegels, when you are actually activating the pelvic floor, you're actually activating it with your core. So you are strengthening your core when you are doing a pelvic floor muscle contraction. Number 3, my pelvic floor doesn't need training like the rest of my body. That's incorrect, because you know the saying, if you don't use it, you lose it, right? So the previous slide that Zazu showed, the pelvic floor muscles are actually 3 layers of muscles. They're very, very small. So if you don't contract them correctly, efficiently, effectively, or if you don't use them at all, then the support and the types of function that they do, which is supportive, sphincteric, and also a shock absorber, will not be effective as you go on through life. So again, if you don't use it, the muscles become atrophied, and then they don't function as well as they need to function. Number 4, I can Kegel, which means my pelvic floor is good to go. Goes with number 1. You can Kegel, which is fine, but you want to make sure you're Kegeling correctly. You've got the vaginal pelvic floor, you've got the rectal pelvic floor muscles. You want to make sure you're getting both groups, all 3 layers of muscles to contract when you're actually doing a Kegel, as well as the relaxation component is what we talked about. And then finally, Kegels are pelvic floor physical therapy. They are a component of pelvic floor physical therapy. We have to stress that pelvic floor physical therapy is a specialized field in the field of physical therapy. Physical therapists are licensed professionals, which means they need to go they need to have the appropriate degree and then go and pass their board exam in order for them to practice as a licensed physical therapist. And pelvic floor physical therapy is a specialized component of that, as I just said. So in terms of pelvic floor PT, we as therapists look at assessment and evaluation. So not only pelvic floor, but we look at the whole body to see what's contributing to a pelvic floor issue. And then we will perform our recommendations for a treatment plan. And then from there, recommend the appropriate treatment plan for each patient. And that could be anything from regular exercise to lifestyle changes to going through habits that patients have or clients have developed regarding their bowel, bladder issues, etc. And I think that's it. So it was a quick 30 minutes, if not more, regarding our myth busting for Kegels. And was there anything else that we missed, Zazu?
No, I think that is it. And yeah, so we were just here to kind of provide some information, especially on something that is talked about a lot, but a lot of times there's not incorrect information out there or outdated ideas. And so we, want to provide what is up to date and the information that everybody should know, regardless of who they are. So next Monday, we're going to be doing a postpartum edition to our Myth Busting Monday. And so yeah, if you want to know more about Kegels, we do have our Ultimate Kegel class, which can be provided via recording for I think $10 or so, which is a nominal fee just to support our practice. But we're here to help you all. So any questions, just post them on our page, and we'll catch you guys next time.
Okay. Bye, guys.